Now, Moxibustion is another interesting ancient Chinese herbal therapy. You take an herb called mugwort, which are leaves, you roll them up and they're burned on specific areas of the body. In this case, we use it for retinal bleeding. Usually cases like diabetes, wet macular degeneration, these conditions that have eye problems. If you can take something like a shell, or in this case we use a snail shell, you warm it up with the Moxibustion, and it actually works very, very well to control retinal bleeding in the acute and chronic phases. So whereas they're using things like Macugen now and injections into the eyes and lasers to help, this is another alternative for people who are sensitive to the lasers or not really into getting the injections into the eye to control the bleeding. Qigong is Chinese yoga, in a sense. It's energy work, it's breathing exercises. The idea with respect to the eyes is to increase the blood flow in the circulation and nerve conduction to the eyes to increase function. When you have good circulation to any part of the body, you're going to have good function. So Qigong is a way of relaxing the body. When the body is relaxed and you focus on doing different massage techniques or visualization or breathing exercise or hand gestures to increase the blood flow to the eyes, you're going to get healing. Now, another easy massage technique that we use is you can use a Qtip. And a Qtip massage is used above and below the orbits of the eyes. I'll give you an example. Here's a Qtip. You gently massage below the eyes and above the eyes. This is if you have eye strain or headaches, or you've been using the computer, watching the TV too long. It's very, very helpful. Really helps relax. Really helps relax the muscles around the eyes if you tend to have that eye strain condition. You can do 2 to 3 minutes. Again, you don't want to bury the Q-tip into your eye. It's not the idea. The idea is a light, gentle massage. Qigong techniques for eye strain. I usually recommend that you do it every half hour spent on the computer or watching TV. Basically, fixating your eyes on a computer screen or a television or a monitor or something like that for anything more than 15 to 20 minutes really causes significant eye strain. So the idea is to move the eyes and or move your body. You can either get up and move around the room and do these types of exercises, or just change your gaze. Instead of fixating your eyes on the TV or the computer screen, change your gaze. Look far, then look clear, look up at your pencil or your keyboard or your nose or something that's in close proximity to exercise the muscles, and then look out the window or look at a painting or something in the distance. The idea is to get the eyes out of that fixated, frozen state, which can be detrimental and very harmful to the eyes over time. Nutrition and supplementation for the eyes is very important as well. The eyes need specific nutrients to maintain health. There are specific nutrients, vitamins, and supplements that are good for the eyes. There are certain foods that are good for the eyes, and there are also certain foods and activities that we want to avoid that can damage the sensitive tissue around the eyes. Some major supplements that I usually recommend for eye conditions that there have been a lot of studies on are obviously vitamin A, which seems to be the most common. Yeah?
What about stigmatism?
Stigmatism. Stigmatism this will help with stigmatism. Stigmatism is a little more of a structural problem. Glad you asked that question. I had astigmatism in both eyes, which I corrected with acupuncture. This is how I actually got into this when I was in school. So stigmatism is correctable. Now they have something called corneal refractive therapy, which is where they have specific contact lenses that they put onto the eye and actually refracts the lens of the eye back so it doesn't have that bend in it. That's interestingly taken from an ancient Chinese practice where they used to put sandbags on the eyes while they slept. They'd fill little bags with sandbags, put them on the eyes while they slept. That also changed and corrected the astigmatism. So I actually read a couple articles where they made these contrasts of similarities. So To answer your question, yes, it's correctable. And you want to understand the underlying cause too. So what's causing the astigmatism? The astigmatism or any of these eye conditions are symptoms. What caused the astigmatism to begin with? Was genetic? Was it stress or so on and so forth, fixating the eyes? So it's a combination. What we're doing here is looking at the condition of the eye, astigmatism, macular degeneration, glaucoma, whatever it is, and wanting to correct that, and also looking at the body. You know, what set that up? And if we correct this with medications or surgeries or corrective lenses or something like that, how are we going to keep it from getting worse? You know, in our country, the eye doctors, which, you know, we need glasses and contacts and all that stuff, but it's the only system of medicine where you go where you're never going to get better, pretty much. You go to the eye doctor. I first went to the eye doctor when I was in 2nd grade. I was 7 years old. They told me your eyes are just going to keep getting worse. Come in every couple of years, we're going to keep giving you prescriptions. So I'm like, you know, I'm going to, but my eyes are never going to get better, so what do? You know, what's the solution? There's no solution. So things like Bates' method and uses different eye exercises, those are helpful as well. The Qigong exercise, and again, back to the nutrients, vitamin A, vitamin E. A thing on vitamin A, too, everybody, or it's pretty common knowledge now, that vitamin A is one of the best nutrients to help support the vision. It's also, we talked earlier about stabilizing the blood sugar. Vitamin A is one of the best nutrients to help stabilize the blood sugar. So again, shows us how blood sugar stabilization is very, very important in maintaining eye health. Vitamin E is tocopherols, very important. Vitamin C, lutein, zeaxanthin, bilberry, eyebright, ginkgo biloba, raw eye concentrate, and then on the bottom, CoQ10. CoQ10 is a great antioxidant. One of the issues with taking things like cholesterol-lowering medication is it strips the body of CoQ10, which is a very, very essential antioxidant that the body needs, especially to keep the eyes healthy. So when that level goes down, the eyes become more susceptible to oxidative stress and degeneration. Foods. There's a lot of people talk today, a lot of great information we heard today about food and diet. Very, very important for your eyes. If your eyes get the nutrients, they're going to maintain proper vision and proper health. Especially the leafy greens. Very important. Kale, okra, spinach, any of these. Very, very important for the eyes, eye health. Your yellows and orange fruits and vegetables, carrots, squash, pumpkin, all these are very important. Whole foods, organic, meat, poultry, fish, eggs, again, all organic. Liver, again, we talked about that correlation in Chinese medicine where the liver needs to be healthy and the eyes need to be healthy. So actually eating liver makes the liver healthier, animal or fowl liver, that will help improve the eyes. I actually have a lot of patients who were from out of the area that I suggested to start incorporating liver into their diet, and they reported that it really made a big difference in addition to the greens and eating a little bit healthier. Blueberries are very good for the eyes. Olive oil, coconut oil is another good oil. Contrary to common belief, fish oil, in my experience, is not good for the eyes. Cod liver oil, in some cases, can be good. But generally speaking, fish oils can cause too much oxidation for the body. Yeah.
Flaxseed.
Flaxseed's okay. And again, that depends if you're deficient or not. And there are a lot of nutritionists out there today who can measure or quantify the levels of essential fatty acids you have and see if you actually need that. So when we talk about nutrients in foods, it's really important that if you want to start getting into this stuff, it's good to have somebody either near you or check with a nutritionist who does some type of metabolic testing or nutritional testing to let you know. Because you can take things that can do harm to your body, even foods and supplements.